We're now with the Health Department, and I'll note that Councilman Pridemore is here bright and early. His attendance has been
Perfect.
remarkable.
Remarkable.
Yes. Dr. Paul, if you could introduce yourself and your colleagues and then make whatever budget presentation you'd like to make.
Morning, Mayor Dean. Morning, Mr. Highnote, Mr. Riebling. With me are Deputy Director Ashley Daugherty and our Director of the Bureau of Finance and Administration, Stanley Romine. Also here, Mr. Sam Felker, who is the Chairman of the Board of Health, Michelle Bell, Dr. Michelle Bell, who's our Director of Dental Services, and Diane Harden, our Director of Finance. Mayor, this is our last budget hearing, and I want to thank you for your leadership and support in moving Nashville toward better health in the last 7.5 years. I would like to touch on some of the accomplishments we've achieved together. First, your health department needs to be able to respond to emergencies, epidemics, outbreaks, and we have. We've led credible and effective public health responses to the H1N1 influenza, to the 2010 flood, and to the current issue with Ebola virus disease. Also in the last 7 years, we've been very proud to join you in supporting your vision of a healthier city. A few examples: we're very pleased to help launch the Nashville B-Cycle, also to support your vision that the new Lentz Health Center could be a model of sustainable and healthy design. Also, with your support, we have facilitated Nashville's first ever community health improvement plan. Success in public health is often about illnesses that don't happen and improvements in health outcomes that don't get very much fanfare. But we are actually starting to see some signs of better community health in Nashville, and there I wanted to list a few where I believe our work, Metro's investments, work of our partners in the community, and your leadership have played a role. Each of these that I'm going to list describes change that has occurred in the last 8 years. One key measure of health, perhaps the key measure of health, is our rate of dying early, rate of premature death. This has actually been steadily declining, and in Nashville it's been declining a little faster than the state of Tennessee. The percent of Metro school children who are overweight and obese has leveled off and dropped from 39% in 2008 to 35% in 2014. The percent of moms who choose to breastfeed has increased 27% in 3 years, from 61% to 84%. Teen birth rate has declined by 60%. Tuberculosis cases have dropped by 1/3. HIV cases are down 24%. HIV deaths have declined 46%. Last week, the county health rankings came out. Davidson County moved from 13th to 6th in the state of Tennessee. We are the healthiest metro area ranked in the state of Tennessee, and that's good news. But we know that the state of Tennessee could be healthier, and the nation could be healthier, and we could be healthier. So we're encouraged, but we know that improving our community's health is a long-term challenge. We've made a start, but we have a long way to go. Turning to the health department budget, out of our overall budget of $42 million, over half, $24 million is funded by grants and contracts. This includes investments in WIC, Ryan White HIV services, school nurses, communicable diseases, emergency preparedness, and air quality. Local taxes and user fees invest $18 million in public health. Mayor, the health department is requesting 2 modest improvements to our budget. The first is $83,000 for dental services. The second is $137,000 for additional staff at Animal Care and Control. As you know, Mayor Dean, our dental safety net needs mending. People are becoming insured through the Affordable Care Act, but too many people still lack dental coverage. For years, this has been a recurring theme. Nashvillians are suffering because they can't afford dental care. You also know from your visits to our new building that we have a new, inviting, state-of-the-art dental clinic. Right now, we don't have staff to use it to its fullest capacity, and I think we should. We should serve more children. We could serve more children, and we could also meet the needs of more adults with serious, painful emergency dental needs. So we're requesting roughly $83,000 in order to fully use our dental facility, serve approximately 100 more patients each month. This amount would support a part-time oral surgeon, 2 days a week for a dental hygienist, 3 days a week for a dental assistant. This will enable us to provide adult emergency dental care 1 day each week on Fridays. This would also enable us to provide oral surgery for children and serve more children each month. So if this request is funded, we would be fully using the dental equipment in our dental clinic every day, Monday through Friday. Now, we know this investment won't solve Nashville's dental safety net problems. We will continue to work on those with others and with partnerships. But if we can at least make sure that we're open to the public, serving customers every day in every chair, I think that would be a positive step. Second, we're requesting roughly $137,000. This is to add 2 kennel staff, 1 field officer to Metro Animal Care and Control. The field officer will improve our response times and also increase our community outreach. The kennel staff will help us keep the shelter open longer. We'll be able to be open more convenient hours for the public and also increase the capacity and the efficiency of the operation. We also believe that this additional staffing will help us better utilize some of the donations that have come in. I will now turn from the improvements to the proposed budget reductions. As you requested of every department, we identified potential cuts equaling 3%. We understand that even if the cuts aren't taken, this exercise forces us to assess where we would consolidate or reduce our efforts, to use staff as strategically as possible, to maintain a level of service to the public with less investment. This year, we respectfully request that you not take any of those cuts, but instead leave the funds in the health department's budget with the confidence that we will use them wisely. I will not go through every one of the listed cuts, but I'd like to highlight a few and give you an idea of what our plans would be if you were able to leave those intact. All of these positions are currently held vacant through the budget process, as it has been our priority and the Board of Health's priority to avoid layoffs. I'll start with number 4. This is a cut that proposes to eliminate an environmentalist position. If this position is not cut, we will use it to provide quality assurance in our air quality lab. So this laboratory measures air quality, and that's a high-stakes issue, not just for the health of Nashville, but also for economic development. We've learned that we are expecting a stringent EPA audit next year, and we need to be absolutely sure that our testing standards are raised and sustained at the highest level of accuracy and quality. The 5th cut eliminates an STD investigator, sexually transmitted disease investigator. I mentioned areas where our health has been improving. We are not seeing a reduction in sexually transmitted disease. Now, we will be paying very close attention to that operation and its performance over the coming year, but at this point, I would really prefer not to be scaling back our efforts in STD. Item number 7 would eliminate a clerical position. If this cut is not taken, we will use the position to improve customer service and reduce the bottlenecks that we're starting to see in our busy immunization and family planning clinics. Item number 8 is the elimination of a senior management position. And if that cut is not taken, we would plan to use this to hire at a lower level a billing manager. Now, we do bill TennCare now, but we've looked at this and we estimate that with a more aggressive and intentional effort, we would see a significant increase in revenue if we paid more, if we were more careful and more aggressive with billing insurance companies. We think that as responsible stewards, we should try to capture revenue if we can so that we can spare local taxpayer dollars. The Affordable Care Act also is changing things for us, how public health services are funded, and along with the state health department, we anticipate a need to be doing better and doing more with billing. To implement billing will require some changes in processes across several clinics, careful attention to detail and oversight, and I think we really need this position to make significant progress on that issue. The final position, if it's not cut, represents a lead public health professional in our efforts to reduce infant mortality and improve maternal and child health. I know this is a position we talked about last year, and it is still vacant, but this year has really been a time of transition. We've used that resource to provide oversight and guidance and support for our home visiting programs, using a seasoned former manager of ours who's been hired part-time. Our long-range need and our intent is to fill this position and strengthen our capacity in family and children's health. Again, some things are getting better, some things are not. A couple things that have not been getting better are our infant mortality rate and the percent of children in Nashville that are born in poverty. And these two go hand in hand, and I think we need to remain and grow in our strength and our services in that area. I know you have many difficult choices and priorities to consider as you craft a budget that addresses those priorities and promotes quality of life for everyone. I want to thank you for your leadership, for the opportunity to be heard, and for the opportunity to serve. Finally, Mayor, I would like to recognize Mr. Stanley Romine. This is Stan's final budget hearing as he heads into retirement. He's devoted himself to serving the people of Nashville and the metropolitan government for 37 years, most recently as the director of our Finance and Administration Bureau. I know your team, Mr. Riebling's team, and our team have appreciated Stan's service, and he will be missed. And with that, I'm happy to answer any questions that you might have.
Okay, well, Stan, congratulations on retirement.
Thank you.
How many budget hearings have you done?
At least 25. But it's been my privilege to serve under 6 mayors and 4 directors of health. And I've really enjoyed working with you and your staff. Greg, Rich, and Talia have been very helpful to the department. But I especially want to thank you for sharing Ashley with us. In the year and 2 months that she's been with us, the things she's accomplished have been remarkable, and I appreciate that.
Well, thank you. Good luck, and we've missed Ashley, but I think she's doing good work with you all. Let's go over a couple things. I went out to animal control, opened up a new part of the facility there, and there's been a lot of changes there. Can you tell us how that's going?
It's been transformational. So one of the things Ashley's put a lot of time in, and she can chime in here as well. Really significant turnover in staff, some staff and hiring significant numbers of new staff. Our new director is very skilled and very capable, and we're very encouraged by that. Increasing number of community partnerships have allowed us to do more and do better in terms of shelter partners, rescue partners that will help us move animals through the facility and reduce the euthanasia rate. The euthanasia rate has been declining. Certainly, numbers of euthanasia have been declining for a long time, but we're really encouraged and energized by the change that's occurring there now. And we kind of want to consolidate that change. As you know, over the years, our level of staffing at animal control is lower than you would see in peer cities like Charlotte, like Austin. And I think this is a time when we really want to make sure that we continue moving on a strong path towards the kind of shelter, the kind of animal services that Nashville needs.
Can you give us more details about the euthanasia rate?
Absolutely. So looking at calendar year 2013 versus calendar year 2014, intake was down, which is good, and arguably good to have fewer animals entering into the shelter, fewer animals. You want to see owners surrendering their animals less frequently. You want to see owners that have the resources to keep their animals. You want to see fewer stray animals that have to be taken into the shelter. So reducing intake, and you want to be sure that outlying counties are handling their animals with their own taxpayer-funded facilities and not funneling them to us. So all of those together. Intake continued to go down calendar year 2014 versus 2013. Intake went down about 800 animals, but yet we euthanized approximately 1,800 fewer animals. So even with the reduced intake, we still reduced 1,000 fewer animals were killed in 2014 versus 2013. A lot of that is due, as Dr. Paul said, to rescue partners. We would like to continue to grow public adoption. One ingredient to doing so would be fully staffing the shelter and being able to be open longer, open more convenient hours, open the times that people need it to be open. But I will second that the new director, Lauren Bluestone, is a real asset. She has integrity, and she has great work ethic, and she has the knowledge needed to continue to move forward.
And she came on board when?
Her first day was July 29th, 2014.
So right at the beginning of the fiscal year?
Correct.
Good, good. And she does seem to be doing well. And so you're partnering with nonprofits on this, right?
Correct. The rescue organizations are a variety. Some are very small, some are relatively large and well-funded that help move animals out of the shelter and find responsible homes for them. And often take animals that may require more resources, that are older, that are sick, that may be pregnant, maybe litter puppies, et cetera, that are.
And then what's going on with the spay and neutering program? Is that?
Would you like to address the request?
Yeah.
The funding request for spay and neuter? So the funding request for spay and neuter is approximately $100,000 to fund 2,000 spays and neuters. But what everyone agrees on is it's not enough just to offer free surgeries. You have to address the other barriers that keep owners from spaying and neutering their pets. Language barriers, cultural barriers. This is not something I'm used to. This is not something I'm comfortable with. And transportation. Perhaps they're elderly. Perhaps they don't drive. So the ask is for a community spay neuter program that will address, not just provide the surgeries with the money, but provide the education, the grassroots effort, the transportation, everything needed to also focus those geographically in the northeast and southeast part of the counties, which is where we continue to see the majority of our intake, continue to see stray and owner-surrendered animals. The Pet Community Center you may be familiar with has done great work offering very low-cost spay and neuter, and they would be a logical partner in that endeavor.
And so this position would do what?
The MAC positions requested would be 1 field officer and 2 kennel officers. Separately, the spay and neuter, community spay and neuter would be operated and run by a nonprofit, not directly by Metro employees. But the additional 2 kennel officers requested and 1 additional field officer requested would be used to provide greater customer service and continue to improve the shelter.
Okay. And then in terms of the dental request, you do have a great facility, and it's important, I think, to make full use of that. What services are available to those who are unable to pay for their own dental care in Nashville?
So to date, our program's really been designed around children and around prevention for children. And so we have a very well-run and very effective dental examination and sealant program with Metro Schools. As we've done this over the years, the number of kids who've had untreated dental disease out in the schools has actually steadily declined because the sealants work. Kids who are identified during that process who don't have another source of dental care are brought into the clinic, and that's been the major work of the clinic is kind of that provision of services to children who have no other source of dental care. What we've struggled with is, since that's our main focus, yet there's this big need in Nashville, and we've heard about it for many years and talked with partners about it for many years, is adult emergency dental care. And we've only been able to squeeze a few patients in here and there to address that need. And part of the request here is to really be open 1 day a week that's largely for adults with those emergency dental needs.
And our dentist is
Yeah, Dr. Bell is here.
Be glad to entertain any questions.
How many, well, tell us what resources you have now.
Currently, we have a dentist on site in the clinic 4 days a week. I'm there on Monday and Tuesdays, and we have a contractor there on Wednesdays and Thursdays. And as Dr. Paul said, our primary goal is to serve children, but we do see adult patients for emergency conditions. That includes pain, swelling, limited to those conditions. Our clinic is not open currently on Friday because we only have part-time staff. And it's been my pleasure to serve in this new clinic. It is amazing. It's the nicest clinic I've had in my 25 years of practicing, and I just want to see it utilized to its capacity with more assistance and more hygienist time. We can see more patients and address these adults who come in. I see them every day, and they're they're in really bad shape. A lot of them are on the verge of hospitalization. So I think these services would be well utilized to have someone in there on Fridays to serve our adult clients who come in. It's very dire, some of the circumstances that we find patients presenting in our clinic.
And also having that oral surgeon on Fridays, not just to serve adults, but also there are some children who come in who are so severe that Dr. Bell can't address them, that a specialist would be able to take care of them.
And how do the children get referred to the health department? How does that happen?
Many ways. We have a very large school-based program, so we have several hygienists who are out there identifying those children and sending them to our clinic for treatment. We have school nurses who will identify children and send them to the clinic. We see TennCare patients, so TennCare will refer patients our way as a provider. Word of mouth, so we have a lot of avenues for children to access our clinic.
Okay, and what's the sort of cooperation or relationship do you all have with the Interfaith Dental Clinic?
We have a very good relationship with the Interfaith Dental Clinic. They see a lot of adult emergencies as well, support us if we have patients that are beyond our ability to treat. So we have a very good working relationship with Interfaith. We also have a good working relationship with Meharry as far as referring some of our patients to their oral surgery clinic for treatment.
Okay.
But we have a lot of patients who show up and say, I was in the emergency room all night, and they do need care.
And Dr. Paul, can you talk a little bit about school nurses? Where are we on that? How's that going?
Well, we provide school nursing services through a contract with, or a memorandum of understanding with the metro schools. We basically fill the needs of the schools in that contract for children who need specific services from a nurse during the day. And so we have, about, I'm going to get it wrong. Is it 40 nurses we got? 60 nurses that we've got. So in general, a nurse will cover 2 or 3 schools. Some schools won't have those procedures that are required. So I would say the main 2 functions of those nurses are providing those services to kids who have specific need for services. And then I think a really important service to Metro is office visits. So Johnny's sick, go see the nurse. Most of the time, the nurse can actually send that child back to the classroom rather than send the child home. And having that presence, I think, helps. Both of those help sustain the educational opportunities for the kids who have medical conditions.
Our goal has been to have 1 nurse in every school, and we haven't gotten there yet. But we did negotiate with the schools to increase by 5 or 6 positions recently. So we're moving toward that goal.
Okay. And then the building itself, how has that gone?
It's gone very
Kind of a boom area, you're out there where everything's happening.
Pioneering.
Pioneering.
Building a fire hall across the street.
Yes.
We really appreciate General Services' support in the new building. It's been great.
Yeah, and the staff are saying positive things, and certainly visitors are saying very positive things. Very impressed with the
Staff's using all the
healthy
wellness
design.
features, right?
Yes.
Everybody's doing that, right?
Yes.
All right.
Now everybody's doing work, and when they have a chance, they're taking a walk here and there.
And the bus rapid transit is there a stop in front of the?
Yeah, there's going to be
There's a
stuff right there
bus shelter right at the facility.
for the BRT light.
That's good. Okay, and then we all met with Sam recently, and we talked about some issues that I think are worth exploring. I mean, one is working with General Hospital and finding ways in which to capture some TennCare or other reimbursement funds. I think that would be a conversation worth having.
Yes, so we've started that conversation. I'm meeting with Dr. Webb on Friday. In the capacity they've gained for billing is largely kind of specialized for inpatients, but we'll explore whether there's things we can leverage there. We know that the state's operation, state health department's operation is more similar to ours, and they actually control a lot of our IT resources. So we are also looking into leveraging that. in terms of facilitating billing and revenue generation.
Okay, and yeah, and I think part of it is too, I know that the software and all the things you need to actually do the billing was a pretty big capital cost for the hospital, and if there's any way to share resources would be
Yes,
a good step.
we'll definitely explore that.
All right, and then I think we also discussed, I think there's opportunities where we are the healthcare management capital of the world and one of the healthcare providing capitals of the United States. And it would seem to me there's real opportunities to work with that portion of our private economy in terms of perhaps creating some sort of support foundation to work. I mean, because clearly, you know, analogous to music, you know, we've taken the position, this is Music City, we ought to have the best music programs in our school, we ought to have more live music than anybody else, and we're the health city, and we ought to be a healthier city, and we got these great resources out there and great leadership, I think, in the healthcare community that we could potentially tap into. It's just a thought, but it seems to me that it would have a lot of appeal, because I think you know, Senator Friss has talked about this, that, you know, there's a lot of things that we could do in Nashville that other cities can't do. And the health department, I think, could provide an important link there. And I'd be, in my limited time left, I would be happy to assist in any way. But that seems to me like something that might be worth pursuing.
Yes, agree 100%. I think there's several opportunities incubating now. Nothing to really talk about on television yet, but that vision is one that I think we can make significant progress on during the next several months.
The Ebola, thanks for your efforts on that. Where are we on that now? Is that
Well, in West Africa, the numbers are going down, so concerted international efforts has been having the effect that you'd hope, that the epidemic subsiding. We continue to be part of the response within the state and within the U.S. of monitoring travelers who've come from those countries, networking and communicating with hospitals, so that if we do get a traveler, we know who they are, we know what hospital they would plan to go to if they got sick. We've talked to the hospital, we've walked through all the procedures that would occur, and the hospitals have really been stepping up and making sure that they are ready for receiving a potential Ebola patient or a traveler who has something else but has to be treated like Ebola for a few days while you're investigating. So the number of travelers from that part of the world is small, but we are always tracking a few and keeping in touch with them, maintaining a relationship so that we're able to respond should anything happen. Most of those travelers are not people who've actually been in contact with patients, but if they are, it's the same procedure.
okay? Rich?
Nothing budget, just want to thank Stan for his service. He's been invaluable and enjoyed working with him over the last few years, and he will be missed, and we do appreciate your work.
Craig?
I don't have anything else.
Okay. Well, thank you for your hard work, and thank you for today's presentation. Well done. And Stan, good luck.
Thank you.
Have fun.
We'll try.
Thank you.
Thank you.
What do you do for fun?